You're sound asleep. The room is dark, the house is quiet, and then, out of nowhere, a pain so sharp, so violent, it yanks you straight out of your sleep. Your calf muscle has locked up like a fist. You grab your leg, you gasp, your eyes water. And for the next 30, maybe 40 seconds, you just lie there, completely helpless, waiting for your own body to let go. If that's happened to you, you already know there are no words that fully describe it. And if someone in your life experiences this regularly, you've watched them suffer through something that looks absolutely miserable. Now here's what most people do after that happens. They drink a glass of water. They stretch for a minute. They go back to sleep telling themselves the same thing they've been told their whole lives. It's just age. It's just what happens after 60. Nothing to worry about. But what if that answer, the one doctors have been giving for decades, is incomplete? What if those cramps aren't simply the price of getting older, but a signal your body has been trying to send you? And what if there's something specific, something nutritional, something backed by real clinical research that could actually help? Here's the short version before we go deep. Research suggests that one commonly overlooked B vitamin may play an important role in circulation, vascular health, and nighttime muscle cramps, particularly in people over 60. That vitamin is niacin, also known as vitamin B3. And by the end of this video, you're going to understand what it does inside your body, why so many people are deficient in it, and exactly what steps you can take to start supporting your circulation today. If this is the kind of content that matters to you, real science, practical answers, explained clearly, subscribe to this channel right now. I'm Dr. Victoria Reed, and this is what we do here. Now let's get into the actual science. To understand why niacin matters for leg cramps, you first have to understand what's happening inside your legs when a cramp strikes. Inside every muscle in your body, there's a network of tiny blood vessels called capillaries. These are the smallest blood vessels in your entire system, thinner than a human hair. And their job is simple but absolutely critical. They deliver oxygen directly to your muscle cells. When everything is working well, this happens effortlessly. Oxygen arrives, the muscle contracts and relaxes smoothly, and you feel nothing. You're not even aware of it. It just works. But when blood flow through those capillaries slows down, when circulation becomes restricted, the muscle cells begin to receive less oxygen than they need. And when a muscle cell is starved of oxygen, it doesn't just quietly wait. It fires distress signals through the nervous system, and the muscle contracts involuntarily in response. Hard, without warning, without your permission. That's the cramp. It's not random. It's not weakness. In many cases, it's your body's way of signaling that something in your circulation needs attention. Now here's where things become genuinely interesting, because restricted circulation in the legs isn't just about cramps. Research published in cardiovascular health journals has noted that in some people, frequent lower limb discomfort and cramping may be an early indicator that vascular health and circulation deserve closer attention. That doesn't mean every cramp is a red flag, but it does mean that dismissing them entirely, for years, without asking why they keep happening, may not be the wisest approach. And this brings us to niacin. Because what niacin does inside the vascular system is unlike almost any other naturally occurring nutrient. When niacin, specifically in its nicotinic acid form, enters the bloodstream in meaningful amounts, it triggers a process called vasodilation. Your blood vessel walls relax, they expand. Blood flows through them more freely, more efficiently. Oxygen reaches muscle tissue that may have been receiving restricted supply. And researchers studying this process have found that this vasodilation effect is measurable, consistent, and clinically significant. In studies involving patients with peripheral artery disease, a condition where blood vessels in the legs narrow significantly, making walking painful, niacin supplementation showed promising results. Some participants reported that their cramping became much less frequent, and a few experienced considerable relief. Researchers noted measurable improvements in blood flow markers. These aren't dramatic overnight miracles, but they are real, documented, reproducible findings. But here's the part of the niacin story that surprises most people, because the vasodilation effect is actually only one side of what it does. Niacin also has a well-documented impact on HDL cholesterol, the kind that's sometimes called good cholesterol. And HDL does something remarkable inside your arteries. It binds to plaque, to oxidized fats, to inflammatory material that accumulates on artery walls over time. And it helps carry that material away to the liver, where it can be processed. Niacin may support circulation in more than one way, including both blood vessel function and cholesterol balance, which is part of why researchers have studied it so extensively in the context of cardiovascular and vascular health. Wider vessels, cleaner vessels, better blood flow. And one nutrient supporting both mechanisms simultaneously. So why are so many people deficient in it? According to data reviewed in the Journal of the American College of Nutrition, a notable percentage of American adults consistently fall short of the recommended daily intake for niacin. And the reason isn't what most people expect. It's not limited to people with obviously poor diets. It affects busy working adults, older men and women who believe they eat reasonably well, and people whose calories come primarily from processed and refined foods. Here's why that matters. When grains are refined, when whole wheat becomes white flour, when brown rice becomes white rice, the outer layers of the grain are removed. Those outer layers are where most of the B vitamins, including niacin, are concentrated. The calories remain, the shelf life improves, but the niacin disappears. And a food supply built largely on refined, packaged, processed ingredients quietly produces a population that isn't getting enough of this specific nutrient. For years, sometimes decades, without ever realizing it. The symptoms don't announce themselves dramatically. They arrive slowly. A cramp here, heavy legs there, feet that feel cold when they shouldn't, a tiredness in the lower body after short walks. Easy to explain away, easy to blame on age, but in many cases, connected to a nutritional gap that's entirely addressable. Now let's talk about what you can actually do. Because the whole point of understanding this science is to give you a practical path forward, and I want to give you that clearly. The first step, and I want to say this sincerely, is to talk to your doctor before making any significant changes, especially if you have diabetes, heart disease, liver disease, or if you're currently taking cholesterol-lowering medication. Niacin in therapeutic doses can interact with certain medications and conditions. Your doctor needs to be part of this conversation. That's not a disclaimer I'm throwing in to cover myself. It's genuinely the right first move, and any healthcare provider worth their time will appreciate that you came in informed and asking the right questions. The second step is to focus on food first. Your body absorbs and uses nutrients most effectively when they come from whole food sources. Foods naturally high in niacin include chicken breast and turkey, which are among the richest sources available. Salmon and tuna are excellent. Beef liver is extraordinarily high in niacin, not everyone's favorite, but nutritionally powerful. Peanuts and peanut butter provide meaningful amounts and are easy to incorporate daily. Brown rice, as opposed to white, retains its natural niacin content. And mushrooms, particularly shiitake, are a surprisingly rich plant-based source. Building 2 or 3 of these foods into your regular meals consistently creates a nutritional baseline that supports your vascular system continuously, without relying on supplementation at all. The third step, if you and your doctor decide it's appropriate, is to consider a low-dose niacin supplement. There are 2 main forms, nicotinic acid, which produces the vasodilation effects discussed in the research, and niacinamide, which is gentler but doesn't produce the same circulatory effects. If the goal is circulation support, nicotinic acid is the form most relevant to the science we've been discussing. One thing to know, nicotinic acid can produce what's called a niacin flush, a temporary wave of warmth and redness, usually in the face and upper body, that begins about 15 to 30 minutes after taking it and fades within an hour. It's harmless. Many researchers believe it's actually a visible sign that the vasodilation is occurring. Taking niacin with food reduces the intensity significantly, and starting with a low dose, perhaps 50 milligrams to 100 milligrams, and increasing gradually over several weeks allows the body to adapt. Most people find the flush response becomes much milder over time. The fourth step is to address magnesium alongside niacin, because the two work on different parts of the same problem, and neglecting magnesium while focusing only on niacin means leaving an important piece of the puzzle unsolved. Here's why magnesium matters so specifically for leg cramps. When a muscle contracts, calcium flows into the muscle cell. When it relaxes, magnesium flows in to push the calcium back out. Without adequate magnesium, the relaxation phase is incomplete. The muscle stays partially contracted, stays primed, stays ready to cramp at the slightest additional trigger. A shift in position, a temperature change, a movement in sleep. Multiple studies have associated low magnesium levels with increased frequency of muscle cramps. And magnesium deficiency, just like niacin deficiency, is remarkably common in the American adult population for exactly the same dietary reasons. Good food sources of magnesium include dark leafy greens like spinach, pumpkin seeds, almonds, black beans, and dark chocolate. A magnesium glycinate supplement is well tolerated by most people and is one of the forms most efficiently absorbed. Again, check with your doctor, especially if you have kidney issues. The fifth step is to support your circulation through daily habits because nutrition alone works best when it's paired with consistent movement and basic vascular-friendly behaviors. Walk regularly. Even 30 minutes a day at a comfortable pace does measurable things for peripheral circulation over time. Stretch your calves before bed because tight calf muscles are one of the most common mechanical triggers for nighttime cramping. Stay consistently hydrated throughout the day. Dehydration thickens blood slightly and can impair capillary flow. And if your daily routine involves long periods of sitting, make a deliberate effort to stand and move every hour or so. Prolonged sitting reduces blood flow in the legs measurably, and it's one of the most underappreciated contributors to lower limb circulation problems in adults over 60. These steps together, niacin-rich foods, magnesium support, possible supplementation under medical guidance, and daily circulation habits, form a coherent, evidence-based approach to addressing the root of what's causing those cramps. Not masking them, not just managing them, actually addressing them at the level where they begin. And I want to leave you with this thought, because I think it matters. We have spent a long time in this culture telling people to simply accept physical decline, to lower their expectations as they age, to take the symptoms of poor circulation, poor nutrition, and poor vascular health, and quietly reframe them as the normal price of getting older. But the human body, even decades into life, retains a remarkable capacity to respond when it's given what it needs. Capillaries can become more responsive. Muscles can cramp less. Circulation can improve. Not in everyone, not instantly, not without effort, but measurably, meaningfully, and sometimes dramatically. Your body is constantly sending signals. Nighttime leg cramps may be one of them. They don't always mean something serious, but they do mean your body deserves attention, not dismissal. Small nutritional changes, better daily habits, and the right medical guidance can make a real difference. And you deserve to know that difference is possible. If this video helped you understand what may be happening inside your legs and gave you a real path forward, please share it with someone you know who has been suffering through those cramps in silence. Leave a comment below telling me how long you've been dealing with this and whether you've ever been told it was just aging. I read every comment and your experience matters. I'm Dr. Victoria Reed. Subscribe to this channel if you want to keep getting real science explained clearly with practical answers you can actually use. I'll see you in the next video.